Now it is being recorded for the public record. The slides and video recording will be sent out to all registered participants within 1 week of today's session. And now, without further ado, I'd like to introduce our presenters, Jean Field and Mindy Mitchell from Homebase.
Hey, everybody. Just want to make sure I'm not muted. Nod. Okay. Yeah. All right. Welcome back. This is session 2 of our amazing Fundamentals of Coordinated Entry cohort. So excited to see you all here. And because we only have an hour together, we won't spend a lot of time on this, at least not talking out loud. If you guys will please add into the chat, as we did last time, your name and organization, your COC or the location that you're in, and what your role in coordinated entry is. We do have that from last time, and we do save the chats, but we hopefully have some new folks and other folks are just joining us. So in the chat, this is our welcome activity. And we want to use this time to hear your responses to the assignment that we had last week, which was for you guys to be thinking about how some other part of the system works that you don't work in, of the coordinated entry system, or come up with some ideas about how you want to better engage with that part of your coordinated entry system. Or for those of you, which is a lot of you that are in smaller communities, what's one area of that coordinated entry system that you really want to improve on and learn more about during this cohort training? Hey, Melissa, welcome. Welcome, John. Glad to see Riverside on. Hey, Nicole, glad you're here. Welcome, Luis. Okay, again, everybody just drop in the chat. We're going to move on so that we don't use too much time. Your name, organization, the role you play in coordinated entry, and where. And then which part of the coordinated entry system do you want most to learn more about or to improve on as a result of this training series? And I will go ahead and move on. Prioritization and assessment is always a big one, Melissa. Just saw that in the chat. And as a reminder, after this 6 weeks of the fundamentals of coordinated entry training, we will have 6 more weeks. Our second cohort will be a really deep dive into assessment and prioritization. So Melissa, hopefully you can join us for those as well. Okay, everybody, keep adding your introductions, your information into the chat, but I do want to go ahead and move on. So today we're going to cover the introductions and welcome we just did, but we're going to spend time today talking about governance, and I'll tell you why in just a little bit. But that's going to include some time discussing coordinated entry policies and procedures, thinking about the oversight and development of your coordinated entry system, management and staffing for coordinated entry, and finally funding for coordinated entry. As usual, we'll kind of end with a wrap up of a Q&A and discussion, a little bit of an activity to get your guys' perspective on your own coordinated entry system and how it's doing on the various aspects of governance. And then we'll talk about next steps. So again, I'm Mindy from Homebase. You guys have met me already. I'm going to give my colleague Jean just a few seconds to come off mute and introduce herself. We're glad to have her here today. I think next week Christiana will be back, but Jean is joining us today. Go ahead, Jean.
Hello, everyone. It's great to see some familiar faces as well as some new ones. I'm excited to learn from you today.
Thanks, Jean. And everybody, of course, don't forget Pickles. She will be reminding you in her role as coordinated entry cat throughout our training cohorts about topics or issues that come up during the training that you want to pay extra special attention to. And again, this is a cohort about the foundational content related to coordinated entry, really fundamental information, designed and suited for maybe smaller staffed COCs that have undergone leadership transition, but also just open to anyone who wants to have a better understanding of coordinated entry by revisiting the basics. And it's something, revisiting those basics, it's always a good time to do that and just make sure we're all on the same page. Okay, just to recap and remind us, this is, of course, that basic definition from HUD about what coordinated entry is. The important parts to focus on here, what we spend a lot of time talking about in our training cohort, are the pieces of this that are in bold. So the thing about coordinated entry, and the important part of it, is that it's coordinated, it's centralized, it's a way for the whole community to participate in helping folks get access to homelessness resource. You do that through an assessment process that's standardized. You're providing those referrals based on someone's needs that you have assessed in that assessment tool. You're covering your entire geographic area. You're making sure that people can access it, right? And that it's easily accessed, that it's equitably accessed, well advertised. And again, that assessment tool is standardized. We talked a little bit about assessment tools last time and some of the misconceptions about that. Okay. So again, some of you might be scratching your heads and saying, why are we talking about governance? That's kind of boring. And I want to freely admit it, that it is kind of boring, but it's also so important. So why is it important to know about governance when we're talking about coordinated entry? Why are we starting with this topic for this fundamentals training? So I think it's, you can think about your coordinated entry system as being made up of 3 entities, or having 3 aspects or functions, right? So there's usually someone, some group, some organization that will have the function of kind of providing your policy oversight. So this will be the group of folks that is defining your policies and procedures, that will serve as kind of that decision-making entity. In most places, this is usually the COC board itself, or a committee on the COC board. Next, you'll have an entity or some aspect of coordinated entry that plays kind of that management role. And this is very much these day-to-day operations of coordinated entry, which we'll talk about. This will be often an organization itself that has that dedicated staff. And this role is usually designated and monitored by that policy entity. And finally, the participating programs themselves have that role that they play in coordinated entry. So they're getting referrals for housing from coordinated entry. Sometimes those programs may also be doing assessments and serving as access points. And again, like we talked about, HUD grantees are required to participate. So depending on how your system is set up, depending on your role within that system, you're going to be in one of these, or for smaller COCs, all of these. I know some of you are probably thinking like, I do all this stuff, right? But you still need to understand the relationship among all of these different entities. And that helps you figure out kind of where your system's capacity is and where the gaps are. And that knowledge then helps you create a more effective, efficient, responsive system that helps us get to our ultimate goal of ending homelessness in our community. Now, we're talking about these as separate entities here for this training, and these responsibilities can be executed separately by different entities, or in some places they might be combined, managed by a single entity or somebody that's been identified by the COC to carry out all of these different tasks. However you do it, it's just really important to see that it's a lot of different pieces of a puzzle to think about. And so that's why we're starting out with thinking about governance for the coordinated entry system. And I think, Jean, you're going to be up next to talk about CES policies and procedures.
All right, thanks, Mindy. And as Mindy noted, one of the thing that's really important is this is a community-wide system, and everyone has a role to play. And by putting out those different kinds of roles and responsibilities, that's a good roadmap for knowing how you could participate and help change the system. One of the reasons we had the exercise last week is because these are evolving systems. We know your coordinated entry system isn't perfect, no one's is, but everyone in the community has an opportunity to help change that and put those into practice to make it better to reflect your community today. So remember those HUD requirements? They're pretty basic, right? And you can see Pickles, I don't know what Pickles has on Pickles' head, but it means it's very important, I'm sure. What is that, Mindy?
We decided last week that Pickles in her Frankenstein outfit is where we're going to put anything that has to do with HUD requirements.
Thank you. It was non-obvious to me. Okay, good. Now we're on the same page about that. Thank you, Pickles. So they are the HUD Frankenstein Pickles requirements right here. And they're pretty basic, right? COCs are required to establish coordinated entry systems. There's a notice, 1701, that puts that into practice. There's specific requirements for policies and procedures, and specific HMIS and data reporting requirements for those grants that are funded to do coordinated entry. That's the system requirement, the COC requirement. The grantees also have requirements, and that is all housing projects funded by COC or ESG programs, and some state-funded programs as well are required to serve clients referred through the COC's coordinated entry system, that one route to these funded programs. Other programs are encouraged and sometimes required to use coordinated entry. So the emergency housing vouchers issued during the pandemic, very successful use of coordinated entry systems. VA programs have found in many communities that this is where they're going to find those most vulnerable veterans that they can serve through their housing programs. HUD is now monitoring these projects on compliance with these requirements. So as Pickles would say, it's not just a good idea, it's the law. But there are a lot of tools above and outside the notice that can help you make sure that your system is compliant and also effective. And one of the things that's referenced on the slide is the coordinated entry self-assessment tool. It's from HUD. It's nicely laid out. It really breaks down. They don't have Pickles, but they do break down the requirements by required, recommended, and optional, which I think is really helpful for communities. All right, so next slide. So one of the things that, if we're going to go down to the real basics, what the notice says needs to be included in those coordinated entry policies and procedures are things like geographic coverage. What does that mean? It means that everyone has access to the system throughout the geography. It's easily accessible. It's well advertised. Folks who need help in your community know where to go to be able to access these services. Then they go on to that middle part. There's a standardized assessment tool. We have talked and we will talk, and we'll talk some more about the fact that there's no mandate what tool you use. It just has to be standardized and something you use for your community. And that assessment needs to be comprehensive so that you know how to prioritize people. And that there is a system in place to help serve survivors who are fleeing domestic violence, intimate partner violence. And we know that sometimes that can be a challenge for communities because of the different systems in use. And I just want to say that these are not the only policies that you need to have in place. These are the core policies that were established by the notice, which makes a lot of sense because this was about how to launch and get started a coordinated entry system. I think if we look at these 3 slides, we know that something's missing. How do we prioritize? How do we then refer people into housing? What's my role as a housing provider? How am I supposed to communicate with a coordinated entry system? These are all things that should be in your policies and procedures. And these are all things that you should work on as a community so that everybody understands what the policies are and how they work. Because without community buy-in, it's not going to be serving your community. making sure a couple of other policies besides that prioritization and referral process is making sure that you're implementing policies that create non-discriminatory and equitable outcomes. It's not enough just to have non-discriminatory policies, but what are the outcomes? What's the end result of those policies? And again, there are tools from HUD and elsewhere, and we'll be going into those later in some of the sessions that we have. But just wanted to mention some of those things because some of them are core policies, some of them are just good ideas. Using HMIS for coordinated entry. There's a whole guide that can help you do that with coordinated entry. Next slide, Dave. As you all know, HMIS is already in place in your community, and everybody knows how to put data in and get data out for the most part, and it should be meeting HUD requirements and standards. You have immediate access to current data in most systems, including service history, intake, assessment, and referral information. So if you're using this for coordinated entry, it's really a great comprehensive coordinated data source for coordinated entry. You know this data is protecting privacy, and you can get some sort of those outcomes that I just talked about. Now, is it required? No. But it is one thing that communities adopt because it means there's no duplication of effort and that you're having all of your information in one source. Next slide. So again, why use HMIS and why use any other kinds of data systems? It's that we need this data to actually accurately measure outcomes and determine client need. I've worked with some clients that used a spreadsheet for the coordinated entry system. It was fine. It really helped them identify. They had a pretty small list. They were going through it, but they weren't really able to accurately track outcome in terms of things like how long were people waiting on the list? What were some of the outcomes of people with different levels of need? In order to do so, they had to reintegrate all of that back into HMIS. So consider using HMIS for the process is what I would say. Next slide. And back to you, I think, Mindy.
Yep, that's me. Thanks, Jean. Okay, I'm going to talk just briefly about the oversight and development part of your CES government. So, we have talked about the what of governance. We've talked about the why of CES government. And for this slide, we're just briefly talking about the who. So in your community, the oversight and development of CES will be governed by these entities. Again, there's a lot of overlap, especially in smaller communities, about what organization, what staff are playing these different roles. But first, we have every COC has its COC board. So this is general oversight of the coordinated entry system, including approving those policies and procedures that Jean just talked about. On your coordinated entry leadership committee, this would be your kind of primary body that governs your coordinated entry system. In the bigger COCs, that's usually a subcommittee of the COC board. You're meeting at least monthly, and you're really looking at implementing and evaluating that coordinated entry system. The very first time we saw that slide with Frankenpickles, and we talked about HUD requiring it, the lead into that conversation was like, there's all these really good reasons to do coordinated entry, and it shouldn't just be about because HUD says you have to. And those reasons are like, you want to make sure that you're really doing a better job by the people that we are called to serve, especially those who traditionally haven't been able to make it into the housing resources that we have. So you are doing, and that's the role of this committee, right? Is like you're really looking at it and you're thinking through how things are implemented. You're evaluating that system, not just with the spreadsheet, right? Like the list on there, but what are the outcomes and how long does it take folks to get in. And when you're doing that through an equity lens, we're looking at demographic data for who flows into the system and who flows out and who gets into what kind of housing and who stays in what kind of housing. We will have a whole session on that at some point, purely just on thinking about equity in coordinated entry. We'll talk about it in this cohort. There'll be conversations about it in the second cohort. And then in the third cohort, we'll have a whole standalone session on it. Really, really important to think about things. And it's very often this leadership committee or the folks who are wearing those hats on the multiple hats that they wear that are doing that. There's also the role of the collaborative applicant. And these are the folks that at the request of the board are going to be applying for the funding from HUD, which will pay for your coordinated entry. And this includes planning grants. Jean will talk at the end kind of about those different funding options. The collaborative applicant is also responsible for ensuring that that SSO, which is supportive services only, coordinated entry grant, gets applied for properly and appropriately through the larger COC competition, the NOFO competition. And for those of you who are, since this is a fundamentals, some of this is beyond kind of elementary stuff. So if there's ever anything that we're talking about here that is kind of like, whoa, what was that word she just said? That sounded very wonky or very weedy. Let us know in the chat. We'll stop and cover it. Tried to get as many acronyms out as we could, but obviously we still have them. Because I just don't think it's possible to talk about some of this stuff without acronyms. So when we have CE in here, that's coordinated entry, just making sure. Now I'm looking at these slides and thinking about that. And then finally, oversight and development is also part of the role that that HMIS lead entity can play. And that's ensuring that your coordinated entry system does have access to the HMIS software, the functionality that Jean just talked about with that software that is doing the data collection, the data management, data analysis, all of that really important stuff about the people that your coordinated entry system is serving, so that we can do that deeper analysis and really use coordinated entry to play that role of improving our whole system. Okay, now we're going to talk, another important part of thinking about the governance of your coordinated entry system is who's managing it and who's staffing it. And we do want to talk about here, like there's a difference between managing the staff, the actual staff people, the FTEs who are doing the coordinated entry work, and the management of the system, right? And this is where eventually we'll talk about kind of the interplay between those housing partners, the program providers, right? And in the actual like coordinated entry system itself. So with managing the staff, and you're thinking about like who is on your coordinated entry team, this implementation is going to vary, of course, based on the coordinated entry process and the capacity of the coordinated entry system, the resources that are available. The most effective coordinated entry implementations have kind of two roles, and that is that there's a coordinated entry manager or coordinator who works for that management entity that we were talking about, and that is leading kind of that day-to-day process of coordinated entry. Then there's also somebody who's playing a system administrator role, and that person is, and sometimes again in the smaller COCs, we see you guys out there, sometimes that's the same person. And that's about overseeing the data entry into the coordinated entry data system. The design of your coordinated entry process and responsibilities assigned to that management entity are going to determine the intensity of kind of that management coordinator and system administrator positions. And then we have kind of thinking about what I was talking about earlier. There's the management also is about managing kind of your system, right? Like who is playing that role? And this is about working with all of those different partners that are providing housing and resources for people experiencing homelessness. So you can think about it like this. So you do have your participating projects, and these are folks who are getting the resources from the COC, or in this case, ESG, or any of those other entities that Jean talked about that are also now saying, hey, I also am requiring you to participate in coordinated entry. And so these projects are required to participate. That's one role that they play, that you're having to manage when you think about managing your partners. But there's also the role of the referral partners. So these are projects that will get and receive the referrals from coordinated entry. There has to be a referral partner agreement with your coordinated entry managing entity that says that it's aware of and will adhere to all of the expectations of coordinated entry. So all of those policies and procedures that Jean talked about. And then we also have to think about what's the role of our mainstream providers in our community. And these are those agencies, usually county level agencies, that can provide all of the other, in addition to like your homelessness housing resources, right? All of those other really important services to folks that are served by coordinated entry. And this may be thinking about what are your hospital systems, right? Like we know that unsheltered folks especially have a lot of over interaction with emergency rooms and other parts of the hospital system. Mental health agencies, because we know, especially for unsheltered folks, that there is such a connection between unsheltered homelessness and serious mental illness or substance use issues, and often co-occurring. And I know you guys also have in California a lot of new funding related to behavioral health and homelessness. So thinking about that too from the coordinated entry perspective, how does that fit into the existing coordinated entry system that you have? Thinking about employment, right? Homelessness itself is a mismatch between how much someone has to pay for housing and how much housing costs, right? And you're working on both sides of those equations. And for folks who can work, increasing income is such an important piece of that puzzle. There was a really good coordinated entry system in a city that is not in California, but that used the employment system, the employment offices where folks go for unemployment benefits. That was one of the access points for coordinated entry. And finally, recovery support programs, schools, especially when you're thinking about further upstream, if you want to make your coordinated entry system more involved with prevention of homelessness, thinking that through, and thinking about the education definition of homelessness, which is more expansive, like how is that going to fit? And like Jean talked about, one of the really very upfront requirements on policy and procedures is how you're going to make sure that your coordinated entry system and that the programs that are involved in coordinated entry are responsive to and are able to serve people who are fleeing domestic violence, dating violence, sexual assault, trafficking, all of that constellation of issues where people's physical safety is a concern. So domestic violence training is required for your coordinated entry staff. And you know what, while I'm thinking about this, I didn't say this at the beginning, but for you guys in the chat, remember that we have this third cohort coming up, and they are going to be 6 standalone sessions. So if topics come up that we talk about in these fundamental sessions that you think, wow, I really want to spend more time talking about that thing, please put it in the chat. Let us know. We want to be really responsive. I think we're going to send some surveys out too, but I just thought about it because I think we also have talked about maybe we have a whole session just on thinking about the relationship and the interplay between coordinated entry and folks who are fleeing that constellation of safety issues. Okay, Jean, I think this one is for you, and we're going to talk about the funding. Money,
Well,
give me that money.
You know I love that money for communities, Mindy. And I will talk about it all day. I do want to circle back though and reflect on the fact of why we chose to do one session on governance and the main components of coordinated entry is because we wanted to have a common vocabulary, because every community and every system should look different to reflect your community strengths and sometimes your existing funding streams and your existing partners, right? And so it's really important to have that same kind of vocabulary as you're pulling apart your policies and you're looking at what you want to improve about your system. We've been called in at home base many times with the request, please rewrite our coordinated entry policies. Of course, we always say yes, but writing policies is not a writing exercise. It's really a system analysis and a community building exercise, because we want those policies to set out a system that works and has all of the fundamental components. So I just wanted to mention that as a reason of why policies and procedures and the governance is such a core background for the work that we're about to embark upon. And as for funding, again, every community is different. So I'm going to mention some of these funding sources, but also thinking that many communities look very different. So those roles that Mindy talked about, say there's a navigator or a housing referral specialist. Some coordinated entry systems will have a dedicated person that's a housing navigator. Other communities will have a consolidated housing navigation person funded by another source, but that the coordinated entry system participants, the housing providers, can rely upon to find those units, for example. Others will try to fund it individually, program by program. Others have really tried to put more funding into coordinated entry to make that a more robust system so that they can easily find participants. They can make sure that their paperwork and documentation is there. They can take a more robust part in that referral system. So again, it doesn't have to be that way. It can just be one or two people in the CES, in the coordinated entry system office, but they're still going to need money for that. So where does it come from? Primarily, it comes from HUD, the federal government, right? They have made this mandate that everyone needs to have, every system needs to have it, and they offer communities the ability to get a grant through their COC. And I think you can get some ESG funding for it as well. Most communities will have a COC grant program through HUD. Veterans Administration also will have some funding available for participation in the coordinated entry system for sure, may not fund the actual system itself. Local governments, state, city, county, public can also designate funding to COCs that can use to support coordinated entry implementation and staffing. As I said, some communities will have, I think one community that I worked with used the Public Housing Authority dedicated a housing navigator that could serve anyone who was homeless, and they could be navigated to public housing access or also any other kind of access. So that, although technically not part of your coordinated entry program, quote unquote, they were part of that coordinated entry team, and that's how they collaborated. COC funding, we talk about, there's a dedicated coordinated entry grant that you can apply for. There's a most communities use that for planning funds, coordinated entry funds. That's how they'll staff a lot of that. There's private funding. Sometimes foundations will, and other community partners can help support the coordinated entry system, understanding how important it is to create that strong pathway to housing. And also, when you're looking at other kinds of funding sources in the community, really recognizing the importance of coordinated entry to the community homelessness and housing network. Healthcare foundations sometimes will recognize this is a way that we can easily access housing for our patients. We can't do that ourselves. We don't have a full-time person that can access every housing system in the community, but we can help contribute to the system that does. So thinking very broadly about those funding sources can be really beneficial.
Thanks, Jean. I think that also gets to the thing that we keep talking about, and we'll keep talking about it, that thinking about coordinated entry as more than just this thing that HUD says you have to do. And especially when you're talking to philanthropic donors, being able to make that argument and paint that picture of this is a way that the whole community can come together and make sure that all of us, with whatever important thing it is that we bring to the pot, is able to get to, in a most efficient and effective way, the folks who need it the most. Like, there's a way to really talk about that is what philanthropic donors want to hear. They want to hear about their funding being used to do something really innovative and at the community level like that. So that's a really important piece of the puzzle. And I'm just ICF team, I'm making notes for myself about potential standalone topics we can talk about in cohort 3. Okay, so I think next we have, let me see if I can put it in the chat. Yes. So this is going to be our activity for today. And I am going to share a different screen now. If everyone can go to the Jamboard. There we go. Can everybody see my Jamboard? All right. Okay. So here's what we're doing. We just talked about governance. These are the topics that we covered: policies and procedures, oversight and development, management and staffing. That's individual staff level and also managing the system, and then funding. So how is your coordinated entry system? And again, this is anonymous. And, you know, if you want to blast your coordinated entry on the chat, you can. But if you want to be anonymous, rate your coordinated entry system. So you might be doing as awesome as we are rocking this one, all the way down to, of course, wait, what is coordinated entry system again? There are different ways you can do this. You guys learned about the pin last time. You can go over to the left here, take a marker, a highlighter, whatever color you want to use, you can change it. Something that you can also do too is the circle. And this will let you just drag across. I want to do a circle, and it'll just leave a circle there. You can drag it around, resize it, right? However you want to do that. So however you want to mark it, you can use your traditional sticky note and say fun things about, if you don't think of my little prompts here, we're getting to what you want to say about your coordinated entry system. But let's rate your coordinated entry system and its governance game. It's really fun seeing the little animal heads moving around too. And for folks who, for whatever reason, can't get over in the Jamboard, feel free to write in the chat. Unfortunately, that won't be anonymous, but you can trust that this is a safe space and even, well, it's a public record. So actually, maybe your COC director will know what you say. Or maybe you are the COC director and you just want to get it out there. That's totally okay. Say fish. Is that a term of art, Chris Pitcher? Oh, I love somebody figured out how to make the circles really tiny. Good one. So it looks like most folks are in that kind of, yeah, we're doing this, but we need improving. And so that is, you're at a great place right now, because that is exactly what these trainings are designed to do, to help all of us get better at this really important piece of our homelessness response puzzle. Looks like on the, if there's any kind of skew to this, Jean, it is on the funding piece of it. So I think that's probably true, that, and it's been my experience in communities that I work with, and is most coordinated entry systems, you have your coordinated entry planning grant, you get that money through the NOFO, and that's about it. That's all you think about. But there's so many other possibilities. And just like when we're thinking about the other pieces of the coordinated entry puzzle and making that kind of like a problem solving and a brainstorming, and let's get innovative and bring together the whole community, thinking about funding for coordinated entry that same way, I think can really kind of increase the budgets.
I agree, Mindy. Just in thinking about what it is that you need funding for. You know, is it better software? Is it something that you need more staffing? Do you need, you know, an annual amount so that you can have somebody come in and do that evaluation and suggest improvements? What are those things? Thinking how you can brainstorm with the community to get that done.
Yeah, and I really like that example of the software, right? Like I could see having a brainstorming session with the community if we're being very specific about like what is it that we want to improve in coordinated entry. Maybe it is software. Is there some philanthropy? I mean, my God, you guys are in California, and for those of you who are in the Bay Area, right? Like there's just everywhere you go, you can, I won't be violent and say punch a startup, a tech startup CEO, but there's some everywhere, right? And there are foundations, and maybe what they specialize in is like, we really want to fund something for a nonprofit that's about using technology in an innovative way. Hey, there's this thing called coordinated entry, and we want to get better at it in so-and-so COC. And we want to think about like how to make sure that rural folks are able to connect better, right? Like there's just, when you start thinking about it in that way, there's lots of possibilities that you can potentially come up with. Okay, has everyone had a chance to participate in the Jamboard? I don't know that I see much of a pattern here, but we have it, except for more on the funding end, kind of need a lot of improvement. There are some of you who are more closer to rocking this, but not quite there yet. So let's think of our trainings here as a way to kind of get us better at that. And you guys can keep participating in there. We do save the Jamboards, and that'll be a part of the work that we do in evaluating ourselves in these trainings. And now we're going to move back to, I think, the presentation. Okay. All right, now is the time for our Q&A and discussion. I've seen a little bit in the chat, but I would like to invite you all to, there's just not a whole lot of us this time, so please come off mute if you want to share out loud any questions or comments that you have about today's training on governance, or in the chat. You can share your favorite pickles moment. Any questions? Any comments? So for those of you who voted on coordinated entry cat, I just had a camera mishap, and it was all from Hunter, who, as you will recall, was runner-up for coordinated entry cat, and he's still resentful about it. Hey, Chris, not third place. I also propose when we wrap up this training series that we bring back all the contestants for coordinated entry cat. Okay, you guys, if there's no question and answer, nothing that you want to discuss further, we will trust that if you have any questions, you will contact us, and you'll see our emails at the end. For now, I want to give you guys a little bit of an assignment for our next session. So, we had our intro session. Today, we talked about governance. Now we're going to really start talking about the pieces of the actual coordinated entry that folks who are experiencing homelessness are going to be interacting with. So our next session is about that access system entry, that piece of the puzzle. So we want your assignment, should you choose to accept it before next session, is that you come prepared to start the conversation, sharing what you know about how most unsheltered folks access coordinated entry in your COC. And when we follow up with the materials, we will put that prompt in to make sure that you have it, so that you can come and share with us what's going on in your COC. How do most folks who are unsheltered access your coordinated entry system? That's your assignment for next time.
Sounds like a pretty
And-
fun assignment to me.
Yeah. Do you know, Kristen, you're not even you're not working for the COC, but
That's
I bet
right.
you've been on enough of these that you kind of know. I think I know for some California communities too, but I definitely want to hear from you guys. So again, next week is we start talking about the actual pieces of coordinated entry that folks experiencing homelessness with are going to be interacting with. So access and system entry, February 20th. We'll talk about that kind of geographic coverage. Where is your coordinated entry? Are you covering everybody? That's part of that equity conversation and thinking about how coordinated entry may be applied and having disparate impacts in your community. We'll use some different examples of where people put those access points. You can, again, get really creative. These are things that you have to have access points, but you can be very creative in the implementation of them. Like I was talking about the city that uses its employment center as an access point. And then we'll also have a conversation about how prevention and diversion fit in to the coordinated entry system, if not the official system, right? Like there's that really far upstream that may not be part of the people are doing assessments and going into the housing lane, right? Then following that on February 27th, we'll talk about prioritization and assessment. As a reminder, this is our fundamentals cohort. So it's kind of our 101 cohort. The second cohort of this training series is going to be 6 full weeks on assessment and prioritization. But this will be just getting us started. And again, all of you are welcome to join all of the cohorts, as many as you want, but that second cohort is going to be a really deep dive. Finally, in week 5 of this training cohort, we'll talk about the most important piece is getting folks housed and referring folks for housing. So we'll have some conversation about different pathways to housing, talk about case conferencing and landlord engagement, all of those really important pieces of getting folks into housing and helping them stay in housing. And then we're going to wrap up this cohort on March 12th, just with kind of an evaluation, talk about what continuous evaluation and improvement of coordinated entry looks like, kind of helping you guys come up with some work plans for your work after this training series, and then just a final Q&A. Again, we are available for you guys anytime. You can contact us by email. ICF team is going to send out all of the resources, the slides here, and again, a reminder of your prompt for your assignment. Anything else that I missed, ICF crew?
I don't think so. I just want to thank you, Jean and Mindy. And on behalf of ICF and California HCD, thanks to all of you for joining us. Please note that a survey will pop up as you exit the session. Please be sure to answer so that we'll know the types of training that you're interested in receiving during cohorts 2 and 3. We'll see you next week for session 3, access and system entry. In the meantime, be on the lookout for the slides and recording from today's session arriving in your inbox very soon. Thank you so much, everybody, and have a great afternoon. Thank you,
Thanks,
Jean
you
and
guys.
Mindy.
Bye.